All right, so we can just keep progressing through these laxatives, right? Drug therapy for constipation. Right now, we're moving on to the stimulant laxative Bisacodyl or Dulcolax. This one stimulates the motility of the colon, increasing water and electrolyte secretion into the GI tract and out of the body. It's therapeutically used for constipation from opioids or slow GI transit. Things are moving through there slowly. It can also be used in colon evacuation for procedures. So if somebody's coming in for for an endoscopy or something where they need to evacuate the GI tract, then they can use this along with other meds. Oral or rectal is how it's given. So orally it can be taken. When it's taken orally, expect semi-fluid stools within 6 to 12 hours. And with the rectal one, you can expect that within 15 to 60 minutes. Okay. Take the oral form at least 1 hour after drinking milk or any antacids. This is because usually these come as enteric-coated supplies, and what can happen, so some of them are delayed release, and some of them are enteric-coated. And the enteric-coated ones, the enteric coating is dissolved by milk and antacids. So that's problematic, and then it doesn't work properly, and then people end up getting cramping, abdominal cramping from that, okay? So the delayed release ones, a lot of times the people get those, post-surgery, or if they're going home on opioids where they're concerned about constipation. Contraindications to using the Bisacodyl Dulcolax, stimulant laxative. Contraindications include obstruction, perforation, fissures, anal or rectal fissures, fecal impaction, ileus proctitis, nausea and vomiting, and undiagnosed abdominal pain. We want to be very cautious, so take precaution in those with eating disorders because they can be prone to laxative abuse. And so that's part of a little trick some people do if they've got an eating disorder to try to keep down their weight. Proctitis can happen if the suppositories are used for a prolonged period of time, and those are the rectal suppositories that would cause that. And burning sensation can happen from the suppositories, so just letting you know that. Diarrhea and abdominal cramping can happen. If there's any diarrhea, you should really stop the medication. Really, we're giving this so that you can end up having not being constipated. And so if we've taken you all the way to the other side, which is diarrhea, we want to stop doing that, right? So as a nurse, we would hold it. And then a lot of times we're covered by an order that says that we can go ahead and hold that, but we could hold it and then get a backup order by the provider.